Hi, my name's Matthew Thomas, and this is my video on shoulder dystocia. Shoulder dystocia is an obstetric emergency which occurs when the fetal shoulders of the infant fail to deliver and become obstructed in the maternal pelvis during spontaneous vaginal delivery. The standard definition of shoulder dystocia is failure to deliver the fetal shoulders after 60 seconds of delivery of the fetal head, or when the chin retracts back into the maternal perineum. This is called turtle sign. I'm now going to show turtle sign on a birthing mannequin. The child's failure to deliver is due to the anterior shoulder here sitting up against the pubis symphysis. What we'll now demonstrate is maneuvers to alleviate the anterior shoulder impacting on the pubis symphysis. The Roberts maneuver requires two assistants in order to passively hyperflex the patient's hips in an extreme lithotomy position. This position promotes cephalic rotation of the maternal pubic symphysis and reduces in lumbar lordosis, therefore results in disimpactment of the anterior shoulder of the child. This one position has been proved to be effective in 42% of all cases. It is a simple position, but it does require two operators. This position is just showing the McRoberts position and how it promotes cephalic rotation of the maternal pubic symphysis. Gaskin's maneuver requires the patient to reposition onto her hands and knees. In this position, downward traction is still applied to the fetal head to allow it to deliver the posterior shoulder. This method has been cited to be up to 80% effective in some studies. As you can see with this mannequin, you still require some downward traction to the fetal head to allow for the posterior shoulder to be delivered. Suprapubic pressure. Suprapubic pressure is often used in conjunction with McRoberts maneuver and involves placing pressure over the suprapubic region in order to disengage the shoulder from the pubic symphysis. Posterior pressure is attempted to push the anterior shoulder under the pubic symphysis, or lateral pressure may also help rotate the fetal shoulders to more of an oblique lie. Suprapubic pressure is combined with McRoberts maneuver has been reported to be successful in up to 80% of cases cited. As you can see, I'm applying pressure downwards whilst my partner is applying gentle traction. Again, this is from a different angle just to illustrate the pressure to the anterior shoulder. So as you can see, I'm pressing down onto the suprapubic region, okay, and I am now applying pressure downwards to the child's anterior shoulder and applying that pressure in a lateral position, hopefully to get the child to move to a more oblique angle. After 30 seconds, I then apply a slight rocking motion to help improve the likelihood of disengaging the shoulder from the pubic symphysis. Internal rotational maneuvers. In this section, we'll be looking at a Rubens 2 and the wood screw. Rubens 2 will be demonstrated first. The officer inserts the fingers of one hand vaginally and positioning the fingertips behind the anterior shoulder. The shoulder is then pushed towards the fetal chest. This officer will now combine the wood screw as well with Rubens 2, using the opposite hand, inserting it vaginally to the posterior shoulder, and the officer will rotate the child 180 degrees towards the symphysis pubis. This hopefully would disimpact the shoulder. Again, in a close-up position, showing the same technique. Finally, we'll demonstrate the reverse wood screw. The reverse wood screw is the reverse of what we just saw. The first hand will be inserted to the anterior aspect of the anterior shoulder, and the second hand will be inserted to the posterior aspect of the posterior shoulder, and it is a reverse rotation of the child, hopefully disimpacting the shoulder from the pubis symphysis and delivering the shoulder. Conclusion. In conclusion, shoulder dystocia is a rare event that requires adequate knowledge and skill to recognize and treat in order to prevent neonatal and maternal adverse outcomes. In the pre-hospital setting, exposure to childbirth is often limited, and it is essential that paramedics are exposed to ongoing education and access to high-quality simulations to improve our ability to perform external and internal techniques. Thank you for watching my video. Please now find my references.